being able to practice all types of osteopathic medicine, so not just the fascial distortion model, but cranial osteopathy.
I think we're really fortunate here because we've got a lot of really great community support. We have a very strong patient base.
We have young athletes. We have a very active, older athletic population. We have people participating in the Senior Olympic Games. We have Olympic athletes in the community. We have the university athletes.
Fairbanks is different. Patients and the community think of OMM first for musculoskeletal issues primarily. And so it's kind of interesting because patients will come to us and maybe not have had evaluation for this issue that they're presenting with anywhere before. So you get to kind of initiate that workup. And I think that's sort of unique to an OMM practice.
When I look at all of the osteopathic manipulative practices I've seen, this is unique in that it's large, supported by the community, supported by the employer and the foundation. And I just think that's the best part of being here. You're not going to be joining a group that is underfunded, undersupported, understaffed.
I really enjoy the fact that we get to work in the hospital and provide our skill set to a wide variety of patients there, as well as in the outpatient setting.
Being hospital employed, you just have all the benefits of being insurance benefits, malpractice benefits, med staff that helps make it sure all your credentialing and privileging is done. Really, like, you get to come to work and see patients and take care of patients, and then all of the other ancillary stuff is taken care of.
Having administration that is dedicated to giving you enough staff that you can see patients at a fast enough pace that you're making money for the clinic, making money for yourself. It's a wonderful setup.
I love the fact that we can have scribes. I think it was really a game changer to come out of residency and immediately have a scribe.
We work in teams where we consider them our patients. They're not my patients. They're not the clinic's patients. They're all of our patients. And the scribes really are an extension of that.
Every provider brings a new piece, a new element. Somebody will bring a different, almost subspecialty in osteopathic manipulation. And, that makes us all better practitioners.
Being in a group this size, if I have a patient that I might be struggling with, but I still think OMM is of value, I might say, hey, go see my colleague for a few visits, and my colleague might have that different, they're seeing something different or doing something slightly differently.
Alaska obviously is beautiful and vast. It is the people that keep you connected.
It's sort of an outdoor lover's dream, but there's also something for everybody here. We've got the university, and they provide like sports and other educational activities and events, concerts to go to, things to kind of keep you busy in the winter. We get some really cool, unique performers that will come to Fairbanks. But really, I think the outdoors are what sells itself.
You can drive 15, 20 minutes in any direction and you're in the wilderness. You get to go hiking, biking, skiing. In the summer, people forget that it's 24 hours of daylight. So even if you leave at 5 o'clock at night, you may be out until midnight fishing or hiking. It's unbelievable. And the beauty and the wilderness of Alaska is unsurpassed. It's just a spectacular place to live and work.